Okay, so are you ready to tackle this neurology chapter?
Yeah.
It's definitely a lot to take in, but we're going to break it down and pull out the most important stuff and make it actually understandable.
We'll make sure you not only get the facts, but also see why they actually matter.
It looks like we've got a whole bunch of different conditions covered here. Strokes, seizures, even movement disorders like Parkinson's. It's like a crash course in everything that can go wrong with your nervous system.
It is pretty comprehensive, that's for sure.
So what we're going for today is basically turning this chapter into like a cheat sheet for neurology. We'll hit those big concepts, the research that everyone's talking about, and even how this all actually plays out in real life.
And we'll make sure it's not just a bunch of dry facts. We want to show you why this stuff is important.
Right, exactly. So how about we start with a quick reminder of how this whole nervous system thing is actually organized?
Yeah.
You've got the central nervous system, which is the brain and spinal cord.
Yeah.
It's like the command center.
Yeah, the CEO of your body.
Right. And then branching out from there is the peripheral nervous system carrying messages back and forth between the brain and the rest of your body.
Think of it like the internet with the brain as the main server and the peripheral nerves as all the cables and connections.
Ooh, I like that analogy. So then within the peripheral system, you've got the autonomic nervous system. This is the part that's running things behind the scenes, keeping your heart beating your lungs, breathing your stomach, digesting, all without you having to consciously think about it.
It really is amazing when you think about it. All those things happening automatically.
Seriously,
Yeah.
it makes you appreciate how much our bodies are doing for us all the time. Now, speaking of things we don't usually think about, did you know there are 12 pairs of cranial nerves connected directly to the brain? These nerves handle everything from controlling your eye movements to helping you taste your food.
They are the ultimate multitaskers, for sure.
So how do doctors actually figure out what's going on in this crazy complex network of nerves?
Well, it all starts with a neurological exam, but these exams are much more than just checking your reflexes.
Oh, I bet. So what kinds of things do they actually do during one of these exams?
They check a whole range of functions. They'll assess your mental state, your cranial nerves, your coordination and reflexes, even the way you walk.
Wow. So it's like they're putting together a puzzle looking for clues about what's happening in your nervous system.
Exactly. And certain patterns during these exams can be really revealing. For example, if someone's reflexes are super strong, we call that hyperreflexia, it can sometimes mean there's a problem in the brain or spinal cord.
That's wild. Okay, so let's talk about one of the scariest neurological emergencies out there, a stroke. It's actually the fifth leading cause of death in the U.S., and when it comes to treatment, every second counts.
It's true. Knowing the different types of strokes can be really helpful in those first crucial moments.
So can you break down those types for us?
Sure, the most common type is what we call an ischemic stroke. This is when a blood clot blocks an artery in the brain, cutting off blood flow to a certain area.
So it's like a traffic jam in your brain, preventing those vital nutrients and oxygen from getting where they need to go.
Exactly. And then there's hemorrhagic stroke, which is less common but often more serious. This one happens when a blood vessel in the brain actually bursts, causing bleeding and putting pressure on the surrounding brain tissue.
I can see why that would be more serious. It's like a burst pipe in your house, causing damage really quickly.
That's a good way to think about it. Now, no matter what type of stroke it is, recognizing the symptoms and getting help fast is absolutely critical.
Yeah, you always hear about that FAST acronym: face drooping, arm weakness, speech difficulty, time to call 911.
It's such a simple tool, but it can be really powerful for remembering those major warning signs.
But I think it's important to remember that there could be other symptoms too, right? Like sudden dizziness, vision problems, or a severe headache that comes on out of nowhere.
You're absolutely right. The key is if you even suspect a stroke, don't wait. Call for help right away.
It's better to be safe than sorry. Now, this is interesting. The specific area of the brain that's affected by the stroke can actually determine the symptoms someone has. So a stroke in what's called the anterior circulation might cause aphasia, which is difficulty speaking or understanding language.
Right. But a stroke in the posterior circulation might lead to problems with balance and coordination.
It's like different neighborhoods in the brain are in charge of different functions.
Exactly.
Okay, let's move on to another dramatic neurological event, seizures. They're kind of like sudden electrical storms in the brain.
And just like with storms, there are different types of seizures.
Right, so what are those main types?
We categorize them as either generalized, which affect the whole brain, or focal, which start in one specific area.
So generalized seizures are those dramatic ones most people picture, right? Loss of consciousness, stiffening of the muscles, those jerking movements.
Right. It's like a sudden surge of electrical activity that just takes over the whole brain.
There's also something called absent seizures, which are more subtle, right? Where someone might just stare blankly for a few seconds.
Exactly. Those can be harder to spot.
And with focal seizures, the symptoms can be all over the place depending on what part of the brain is involved.
That's right. You might have strange sensations, uncontrolled movements in one limb, even changes in your mood or thinking. And sometimes focal seizures can actually turn into generalized seizures.
So it's like the electrical storm starts in one part of the brain and then spreads to the whole thing.
That's a good way to visualize it.
So how do doctors actually figure out what type of seizure someone is having and what's causing it?
One of the key tools is an EEG, or electroencephalogram. It's a painless test that measures the electrical activity in the brain, so doctors can see those abnormal patterns that come with seizures.
It's like listening to the brain's electrical symphony and looking for any notes that are out of tune.
I like that analogy. Doctors might also use imaging techniques like MRI or CT scans to rule out any structural problems in the brain that could be causing the seizures.
Making sure there's no faulty wiring in the brain's electrical system.
Exactly.
Okay, let's switch gears now and talk about a chronic neurological condition that can be really challenging to live with: multiple sclerosis.
Multiple sclerosis, or MS, is an autoimmune disease. That means the body's own immune system mistakenly attacks the protective covering of nerve fibers in the brain and spinal cord. And this disruption in communication between the brain and the rest of the body can lead to a whole bunch of different symptoms.
So it's like the insulation on electrical wires getting damaged.
Mhm.
The signals can't travel as well, and sometimes they get messed up completely.
That's a great way to put it. And that's why the symptoms of MS can be so diverse. Some people might just have mild numbness and tingling in their hands and feet, while others might have more serious symptoms like paralysis or vision problems.
And the course of the disease can be unpredictable too.
Yeah, right.
Some people have those relapses and remissions where symptoms flare up and then calm down, while others have a more progressive form where the symptoms just get worse over time.
You're exactly right. It can be really hard to predict how MS will progress in any individual.
So how do doctors even diagnose MS if there's no single test for it?
Well, it's kind of like putting together a puzzle. They have to look at a bunch of different clues. So they'll look at the patient's medical history, trying to see if there's a pattern to their symptoms. They'll do a neurological exam to check how well their nerves are working. And one of the most important tools is an MRI scan, which can show those lesions or damaged areas in the brain and spinal cord.
So it's like looking for footprints in the snow, trying to track how the immune system has been attacking the nervous system.
Exactly. And sometimes doctors might also do a lumbar puncture, which is also called a spinal tap.
Oh yeah, I've heard of that. What is that exactly?
It's where they take a small sample of cerebrospinal fluid, the fluid that surrounds the brain and spinal cord. And with MS, this fluid often has specific abnormalities that can help confirm the diagnosis.
So it's like collecting evidence from a crime scene, trying to figure out who's responsible for the damage.
Right. And although there's no cure for MS, there are medications that can help manage the disease and improve people's quality of life.
So is that where we're headed next?
Let's dive into those treatment options and then explore another complex condition, dementia.
Perfect, I'm ready when you are.
So when someone's had a stroke, one of the first things doctors will do is order imaging scans like a CT scan or an MRI.
Right, to get a clear picture of what's happening.
Exactly. These scans help pinpoint the type and location of the stroke, and they really guide the treatment decisions.
It's like having a map showing exactly where the damage is in the brain so doctors know how to proceed.
That's a great analogy. Now, for ischemic strokes, the ones caused by a blockage, one of the most important treatments is what we call clot-busting medication.
I've heard of that. So it basically dissolves the clot and gets the blood flowing again.
Right. It restores blood flow to that area of the brain that's been affected, but time is really of the essence here.
Oh, I bet. So how quickly do they need to give this medication?
It's most effective when it's given within a few hours of when the symptoms first started. That's why recognizing the signs of a stroke and calling 911 immediately is so important.
It can literally mean the difference between life and death.
Absolutely. Now, if the stroke is hemorrhagic, meaning there's bleeding in the brain, the approach is totally different.
Okay, so how do they treat that type?
Well, instead of trying to break up a clot, the focus shifts to controlling the bleeding and reducing the pressure on the brain. This might involve medications or even surgery in some cases.
So it's really about tailoring the treatment to the specific type of stroke and the patient's individual needs.
Precisely. And of course, prevention is always the best medicine. Managing those risk factors like high blood pressure, high cholesterol, and smoking can significantly reduce your risk of having a stroke in the first place.
It's like taking care of your car. Regular maintenance can prevent major breakdowns down the road.
Exactly. Now let's move on to seizures. We talked about how they're like electrical storms in the brain, but how do doctors figure out what's triggering those storms in the first place?
Yeah, I was wondering about that. So how do they diagnose seizures?
Well, one of the key tools is an EEG or electroencephalogram.
Remind me what that is again.
It's a completely painless test that measures the electrical activity in the brain, and it allows doctors to see those abnormal brainwave patterns that are associated with seizures.
Oh, right. So it's like listening to the brain's electrical symphony and picking out any notes that sound off.
I love that analogy. Now, in addition to an EEG, doctors might also use imaging techniques like MRI or CT scans to rule out any structural abnormalities that could be causing the seizures.
Like making sure there's no faulty wiring in the brain's electrical system.
Precisely. Once they've determined the type and cause of the seizures, treatment often involves medication to help control that abnormal electrical activity.
So how do those medications work?
Well, they basically calm down the overexcited brain cells, essentially turning down the volume on that electrical storm.
Interesting. So it's like giving the brain a little bit of a chill pill?
You could say that. Now, remember how we talked about multiple sclerosis and how it's like the insulation on electrical wires getting damaged? Well, that's where the diagnostic challenge comes in.
Oh, right,
Yeah.
because there's no single test for MS, right?
Exactly. Doctors have to rely on a combination of clues to make the diagnosis. So they'll look at the patient's medical history, searching for patterns in their symptoms. They'll do a neurological exam to assess nerve function. And one of the most important tools is an MRI scan, which can reveal those telltale lesions or areas of damage in the brain and spinal cord.
Like looking for those footprints in the snow, trying to trace how the immune system has been attacking the nervous system.
That's a great way to think about it. And in some cases, doctors might also perform a lumbar puncture, also known as a spinal tap.
Ah, yes, the spinal tap. Can you remind me what that involves?
It's a procedure where they collect a small sample of cerebrospinal fluid, the fluid that surrounds the brain and spinal cord. And with MS, this fluid often shows very specific abnormalities that can help confirm the diagnosis.
So it's like gathering evidence from the crime scene, trying to identify the culprit behind the neurological damage.
Exactly. And while there's no cure for MS, there are medications that can help manage the disease and improve quality of life.
That's good to hear. So what kinds of medications are we talking about here?
Well, some of them work by modulating the immune system, essentially trying to reduce the frequency and severity of those relapses, those periods where the symptoms flare up.
It's like turning down the volume on the immune system's attack, preventing further damage to the nervous system.
Exactly. And other medications focus on relieving specific symptoms like fatigue, muscle spasms, or bladder problems. And then there are some newer medications that are aimed at actually protecting nerve fibers from further damage, essentially trying to rebuild that damaged insulation.
Wow, so they're trying to actually repair the damage that's been done.
That's the goal, and it's really encouraging to see the progress that's being made in MS treatment. Now let's switch gears to a condition that we often see later in life, dementia.
Okay, so we talked about how dementia isn't just simple forgetfulness. It's a decline in cognitive abilities that actually interferes with daily life.
Right. And Alzheimer's disease, the most common type of dementia, accounts for a significant portion of those cases.
But Alzheimer's isn't the only cause of dementia, right?
Absolutely. There are other culprits out there.
Hmm.
Vascular dementia, for example, is caused by reduced blood flow to the brain, often due to things like stroke or atherosclerosis. It often presents with a more stepwise decline in cognitive function, unlike the gradual decline we see in Alzheimer's.
So it's like a series of mini strokes, each one causing a small drop in cognitive ability, and over time those small drops can really add up.
Exactly. And then there's frontotemporal dementia, which mainly affects the frontal and temporal lobes of the brain, the areas involved in personality, behavior, and language.
And this type often presents with changes in personality and behavior rather than memory problems, at least in the early stages.
Right. It's like the control panel for personality and decision-making is starting to malfunction, leading to things like impulsive behavior or inappropriate social interactions.
That can be really tough for both the person with dementia and their loved ones.
Absolutely.
And let's not forget Lewy body dementia, which is characterized by fluctuating cognitive function, visual hallucinations, and movement problems similar to those we see in Parkinson's disease.
It sounds like a really complex condition to diagnose and manage.
It can be because it's almost like a combination of different neurological challenges all rolled into one. Now, diagnosing dementia requires a really comprehensive evaluation, taking into account the patient's medical history, the pattern and progression of their symptoms, and the results of a variety of tests.
So it's not a simple diagnosis.
Not at all. Doctors will often do a really detailed neurological exam focusing on cognitive function, and they might use neuropsychological testing to evaluate things like memory, language, and problem-solving abilities in a lot more detail.
So it's like giving the brain a thorough workout, assessing its strengths and weaknesses to get a better understanding of the extent of the cognitive impairment.
That's a great way to put it. And they might also use imaging studies like CT scans or MRIs to rule out other conditions that could be causing the symptoms, things like brain tumors or hydrocephalus, which is a buildup of fluid in the brain.
So they want to make sure there's no structural damage that's causing the cognitive problem.
Exactly. Now, while there's no cure for most types of dementia, there are medications and therapies that can help manage the symptoms and slow the progression of the disease.
So what are some of those treatment options?
Well, for Alzheimer's disease, for example, there are medications that can temporarily boost the levels of certain neurotransmitters in the brain, which can help improve cognitive function for a period of time.
So it's like giving the brain a little boost of energy to help it work more efficiently.
That's a good way to think about it. And for other types of dementia, treatment often focuses on addressing the underlying cause, whether it's managing vascular disease or slowing down that neurodegenerative process.
And I imagine providing support and care for both the patient and their family is really important as well.
Absolutely. It's such a crucial part of managing dementia. Now let's dive into those fascinating movement disorders, starting with benign essential tremor. We talked about how it causes that rhythmic shaking, often in the hands, that can make everyday tasks so difficult.
Right. And it often runs in families, right?
It does, which suggests there's a genetic component. While the exact cause is still unknown, we do know that treatment often involves medications like beta blockers, which can help calm those overactive muscles and reduce the tremor.
Like putting a damper on that involuntary shaking to allow for more controlled movement.
Exactly. Now let's talk about one of the most well-known movement disorders, Parkinson's disease.
Okay. So remind us what causes Parkinson's again.
It's caused by a loss of those dopamine-producing cells in the brain. And that lack of dopamine leads to a really classic set of symptoms. Tremors at rest, muscle rigidity, slow movements, and problems with balance.
It sounds incredibly frustrating to live with those symptoms. Imagine feeling like your body is stuck in slow motion with those stiff, jerky movements.
It can be really debilitating. Treatment for Parkinson's disease often involves medications that either replace dopamine in the brain or mimic its effects. Deep brain stimulation, which is a surgical procedure that involves implanting electrodes in specific areas of the brain, can also be an option for some patients.
So it's like rewiring the brain's circuitry to improve movement control, bypassing those damaged areas.
That's the idea.
Yeah.
Now let's talk about Huntington's disease, which is a genetic disorder that unfortunately affects both movement and thinking.
Right. It causes those involuntary jerky movements called chorea, and it also leads to cognitive decline. Right?
You're exactly right. So you see things like memory loss, difficulty with thinking and reasoning. It really is a double whammy affecting both the body and the mind.
And there's no cure for Huntington's, is there?
Sadly, no. But medications can help manage the chorea and some of the other symptoms. Supportive care, focusing on maintaining quality of life and providing emotional support for both the patient and their family, is also incredibly important.
It's a good reminder that sometimes the best we can do is provide comfort and care as someone navigates a challenging and progressive illness.
Absolutely. Now for our last stop on this movement disorder tour, let's explore Tourette syndrome.
Okay, so this is the condition with those sudden repetitive movements or vocalizations called dechants, right?
Exactly. Imagine having this uncontrollable urge to blink, repeatedly shrug your shoulders, or even shout out a word or phrase. These punks can be incredibly difficult to control, and they can cause a lot of social anxiety and embarrassment.
I can only imagine. It must be really tough to live with.
It can be. Now, the exact cause of Tourette syndrome is still unknown, but it's likely a complex interplay of genetic and environmental factors. Treatment often involves a combination of medication to help control the deck tics and behavioral therapies, like habit reversal training, which helps people become more aware of their deck tics and develop strategies to manage them.
So it's about retraining the brain to interrupt those involuntary movements and replace them with more controlled behaviors.
Precisely. Now, we've covered a lot of ground, haven't we? We've explored the complexities of stroke seizures, multiple sclerosis, dementia, and all those fascinating movement disorders.
We really have. It's been quite a journey.
It has, but remember, we've really just scratched the surface of this vast field. If you're interested in learning more about any of these conditions, there are tons of resources available online and through reputable medical organizations.
Knowledge is power, especially when it comes to our health.
Absolutely. So let's take a moment to just appreciate the incredible complexity and resilience of the human nervous system. It really is a marvel of nature, and understanding how it works is essential for both diagnosing and treating these neurological conditions.
Okay, so next up, we're going to shift gears and talk about those conditions that can affect the peripheral nerves, those vital connections extending from the central nervous system to the rest of the body.
These are the nerves that allow us to feel the world around us and control our movements. And when they're not working properly, it can lead to a whole host of challenges.
Sounds intriguing. I can't wait to dive in.
So we've explored all those conditions affecting the brain and spinal cord, but remember, the nervous system doesn't just stop there.
Right, it goes way beyond that.
Exactly. It's time to explore the peripheral nerves, all those branches that extend out from the central nervous system, reaching every corner of your body.
These are like the communication highways carrying messages back and forth so we can feel the world and move our muscles.
Precisely. Well, what happens when those lines get crossed? Well, that's when you can start to experience some pretty strange and often debilitating symptoms.
So let's talk about what can go wrong with those peripheral nerves.
Okay. One common condition is Bell's palsy. Have you ever heard of that?
I think so. It's like when one side of your face droops, right?
That's it. It's a sudden weakness or paralysis of the facial muscles, usually just on one side.
So you can't really smile properly or close your eye all the way.
Exactly. It can be pretty alarming to wake up one morning and realize you can't move half your face. The exact cause of Bell's palsy is still a bit of a mystery, but it's thought to be triggered by inflammation of the facial nerve, the one that controls all those facial muscles.
So is it permanent?
Thankfully, no, Bell's palsy is often temporary, and it usually resolves on its own within a few weeks or months. Treatment might involve corticosteroids to reduce the inflammation, and sometimes antiviral medications, although their effectiveness is still being debated.
It really makes you appreciate how much we rely on those facial nerves for communication and expression.
It does. Even a temporary disruption can have a huge impact on our lives. Now, another common condition that affects the peripheral nerves is diabetic neuropathy.
Right, that's a complication of diabetes, isn't it?
It is. It's caused by high blood sugar levels damaging the nerves over time.
So those high blood sugar levels are essentially toxic to the nerves.
You could say that. It's like they're slowly wearing away at the protective coating of the nerves.
And I imagine the symptoms can vary depending on which nerves are affected.
Absolutely. Some people experience pain, tingling, or numbness in their hands and feet, almost like a constant pins and needle sensation. Others might have problems with digestion, bladder control, or even heart rate regulation.
So it really highlights the importance of managing blood sugar levels in diabetes.
It does. Diabetes isn't just about managing blood sugar. It can affect the entire body, including those peripheral nerves, and the complications can be pretty serious.
Okay, let's talk about another condition that affects the peripheral nerves, Guillain-Barré syndrome.
Have you heard of this one?
It rings a bell, but I'm not sure what it is.
It's an autoimmune disorder, which means the body's own immune system is mistakenly attacking the peripheral nerves.
So it's like your immune system is going rogue and attacking its own team.
Exactly. And the symptoms often start with tingling and weakness in the legs, and they can spread pretty rapidly to the arms and upper body.
How quickly are we talking here?
It can progress so fast that some people end up needing a ventilator to help them breathe. It can be really scary.
Wow. So what's the prognosis for Guillain-Barré?
The good news is that most people do recover from it, although it can take weeks or even months. And some people might have some long-term effects. Treatment usually involves procedures like plasmapheresis, which filters the blood to remove those harmful antibodies, or intravenous immunoglobulin therapy, which helps to kind of rebalance the immune system.
It's amazing how those treatments can calm down that overactive immune response.
It is. Now, for our last stop on this neurological tour, let's talk about myasthenia gravis.
Myasthenia gravis. Okay, I don't think I've heard of this one.
It's a condition that affects the communication between nerves and muscles. Basically, the immune system attacks the receptors on muscle cells that receive signals from nerves.
So the message from the nerve can't get through to the muscle.
Right.
Yeah.
It's like the message gets lost in translation and the muscle doesn't get the memo to contract.
I see. So what kind of symptoms do people experience with myasthenia gravis?
Well, they often have drooping eyelids, double vision difficulty speaking or swallowing, and weakness in their arms and legs. And the symptoms typically get worse with activity and improve with rest.
So it's like their muscles get tired much faster than normal.
Exactly. Treatment for myasthenia gravis often involves medications that improve that nerve muscle communication, like cholinesterase inhibitors. They basically boost the signal from the nerve so it can get through to the muscle more effectively. Other treatments include immunosuppressants to calm down the immune system and sometimes surgery to remove the thymus gland, which is involved in the immune system.
Wow, so we've really covered a lot of ground, haven't we? We've explored so many conditions affecting the brain spinal cord and all those peripheral nerves.
We have. It's been quite a journey through the intricate world of the nervous system.
It really makes you appreciate how complex and amazing our bodies are.
It does. And it highlights how important it is to take care of our nervous systems.
Absolutely. So big thanks to everyone for joining us on this deep dive into the fascinating world of neurology.
We hope you learned something new and maybe even struck some curiosity to explore this field further.
And remember, if you're experiencing any neurological symptoms, don't hesitate to reach out to your doctor. Early diagnosis and treatment can make all the difference. Until next time, stay curious and keep those brains buzzing.